We have Christina here today. She was very kind to be my model. And for today, we're gonna be doing neurotoxin injections on her, and we're gonna be using Daxxify. So as you guys know, Daxxify is the newest toxin in the market, and it's the only one that has a peptide in the formulation. Why is this different? Because no other neurotoxin in the market has a peptide, and this peptide helps the skin level. So it's like an anti-aging add-on to your botulinum toxin. So that's why it's so unique. For Christina, she has never had any neurotoxin done before except in the nose, which we did last week.
Yep.
Last week. So today we're going to be doing the frontalis, we're going to be doing the glabella, and we're going to be doing the orbicularis oculi, which is the crossfeed. So first thing first, I always ask my patients to animate because I want to see the movement of her muscles. Why is this important? Because I cannot blindly just inject. I need to know exactly where she's pulling from so I know where am I going to inject the neurotoxin so I can relax that area of the muscle. So let's talk about anatomy for a minute. So the frontalis muscle is responsible for lifting your eyebrows. So it's interesting to me when I get a client saying, I want you to put Botox in here so you can lift my eyebrows. I'm doing the whole contrary. If I put Botox here, I'm gonna drop your eyebrows because the frontalis is an elevator muscle, and the whole job of the elevator muscle is to lift your eyebrows. So when people have a lot of wrinkles in this area, I try to stay as high as possible, and I always let them know I won't be able to knock out the whole movement of the muscle because I don't want to drop you. So I let them know that yes, I'm gonna get rid of the wrinkles on the top, but they will probably still have some wrinkles in the middle. I bring them back in about 2 or 3 weeks. I had them animate again. And if I see that the muscles still have a little bit more movement, then I know exactly where do I need to go to relax that area. I go very superficial just to get some of the fibers of the muscle, but not to completely knock out the muscle. Go ahead and lift your eyebrows. So she does have a lot of movement laterally and medially. So in her case, even though I know in anatomy, she doesn't have a muscle right here, I'm gonna still inject in the middle. Relax. Go ahead and lift again. So if you can see, she doesn't have a lot of movement or a lot of wrinkles in this area, but I'm gonna still put about 2 units of Botox in this area. Relax. Lift again. So this is the map of where I will definitely inject her. Not everybody is the same. That's why you need to have them animate so you can know where you're going to inject. That's why I always tell injectors, you need to take anatomy classes. You need to practice on cadavers because not everybody has the same anatomy. So I don't want injectors to take a class and memorize a pattern, not knowing what you're doing when you're injecting. Do an angry face for me. So she has a very strong procerus. So if she doesn't start getting Botox at this age, by the time she's probably 40 or 50, she's gonna have those 2 lines that we call 11s, and it's gonna be very hard to get rid of those. So she's being preventative at this point. Okay, do the angry face again. So we're gonna knock out the belly of the muscle, which is right here. And then I wanna see where she's pulling from. So as you can see, she's pulling from here, and I'm gonna superficial go in there. Angry face again. So this injection is very deep. This too, you want it to be more superficial, and the reason for that is because behind this glabella complex, there are frontalis muscle. So if I go too deep in here, there is a possibility that I can put Botox without knowing in the frontalis muscle. And if I do that, instead of lifting, I'm dropping. And she's gonna hate me for that and never gonna come back and leave me a bad Google review. And we don't want that. Okay, go ahead and smile real big. She doesn't have too much CrossFit, so we're just gonna do 2 points injection of 2 units each over there. I get a lot of patients and a lot of DMs in social media asking me, how can you lift my eyebrows? And there are 2 muscles that you need to knock out is the glabella complex, because this muscle, so this muscle is like a sphincter and it's pulling everything down. So in order for me to lift the eyebrow, I have to knock out this muscle and I have to knock out the orbicularis. They're both like sphincters, they're always contracting. So you put toxin around, you put toxin here, it's going to relax, and by relaxing is opening. That's how you actually give someone a lift, not by putting way too much toxin in the frontalis. There are some other areas that we're not going to be doing today, but you can do botulinum toxin. One of those areas is the nose. I already did it here, so I don't have to do it again, but you can slim the nose by putting toxin on specific areas on the nose. You can also do toxins on the DIO, which is this muscle right here that is pulling down the corners of the mouth. So there's a lot of people that walk around looking like they're sad, although they're not really sad. Is because that muscle continues to pull downwards the corners of the mouth. And that's one of the reasons why people get their marionette lines. They want filler to feel that, which is not the actual treatment for the marionette lines, right? So prevention, prevention, prevention. Put unit on the DIO and you're not gonna be pulling down. Another area that you can do tox is on the top of the lips. So we call this a lip flip. So you put about 4 to 8 units on this area and it's going to relax this muscle and flip the lips like this. You can also do toxin on the chin, and you can also do toxin around the jawline to relax the platysma band. See? She doesn't really have a lot, but there's other people that have a lot of platysma bands, and this is what pulling down the skin. So if you relax the platysma bands, you're avoiding more jowling as you get older. Another area that I'm not a fan of injecting, I only do it for medical reasons, like when someone has like TMJ, they're always kind of clenching their teeth in your jaw, that you can do masseter on that area. But the thing is that if you overdo it throughout the years, you're shrinking and putting this muscle smaller and smaller. So it's gonna get to a point that yes, your skin is gonna be and your face is gonna be very slim, but you're gonna start having jaws and saggy skin because this muscle is supporting your skin up. So you treat it, what's going to be supporting your skin? Nothing. And then you're gonna come and say, I want to put fillers over there because I shrink your muscle. So someone that is young, I'm okay with doing it. But if someone is 35, 40, or 50, I will not touch your masseters at all, unless it's for medical reasons. Okay? Do you have any questions? Perfect. Makes sense. So we're gonna go ahead and mix our product. This is a new bio. Dexify, expiration date is December of 2025. I always show this to my clients so they're never not using an expired product on them. And Dexify comes in like a little powder. So you have to reconstitute it with bacteriocyte water, which we have right here. And we are going to use 1.25 mLs of bacteriocyte water. You can do 1 ml, you can do 1.25, but it's not recommended to go higher than 1.25 mLs for the reconstitution of the Dexify. Okay, so we are already clean, but again, I'm gonna clean again. And it's 1.25. How do you know you don't have a counterfeit product? Is when I put the needle in, the actual bio absorb the liquid. You did not see me pushing. So this is true for neurotoxin, not for Sculptra or anything like that. But for neurotoxin, you want to make sure that the bio absorb the whole liquid inside. Gently move it. It's not like with Sculptra, we have to be shaking with this. You just gently move it. And then, do you have the opener? Daxxify is the only neurotoxin that makes it difficult for us to open. Literally. Except this time, obviously. So I like to open it like this. That way, I don't have to go through the rubber with the needle, because then it's going to be more painful to the client. So we're gonna go get ready. For her injections, I have my insulin syringes, which is what we use for neurotoxin. I prefer 50 units or half ml needle. Sometimes I like the 30, but in reality, I prefer the 50 units. It's just easier for me to remember how many units I have on the syringe. So the first needle I'm going to draw is gonna be her glabella. She does have a very strong glabella, so I'm gonna go a little bit more higher than usual. So for the glabella, for females, 20 units should be enough, but because I know she has a very strong glabella, I'm gonna go a little bit higher, so I'm gonna go for 25 units. Her frontalis, I don't like to over-treat because again, I don't wanna knock out completely the movement of the frontalis muscle. So I might go to, let's see. I'm gonna go for 14 units on her frontalis. She might need more, but that's the beauty of following up. So I always tell my patients, please come to your follow-up because I need to know if the amount of units I put on you, it is enough for what we're looking for. And last but not least are her crow's feet. She doesn't have a lot, so I'm just gonna do 4 units at each side, and then we reassess again in 2 weeks. Any questions before we start? No? So I'm gonna go first in the glabella. What's important, and this is for injectors, this is not for patients, this is for injectors. You want to grab the belly of the muscle, because if you don't grab the belly of the muscle, you might be injecting too superficial, and that's why some clients don't see a lot of results. So now I have the belly, 1, 2, 3. You okay? Mm-hmm. You see why I'm holding pressure and keeping my thumbs in here is because I don't want the toxin to spread a little bit lower, because when it's, this one is very superficial. Botox, it is FDA approved for migraines, but not cosmetically in here. So when we do Botox for migraines, we do around this area here, behind the ear, occipital muscle, and trapezius muscle. So but it is FDA approved for migraines. So insurance should be able to cover it if you have good insurance. With Daxi, we have to go very deep because you want Daxi to get the whole muscle. Go ahead and smile. this is how you do a toxin treatment. Now, post instructions, we always give written instruction to our patients, and it also gets sent out to your email. So please read your emails because we send post instructions all the time. We don't want the client after Botox to be rubbing the area or massaging the area, not laying down for the next 4 hours, no exercise, no sauna, no jacuzzi for the next 4 hours. That's the instructions for Botox. And you can do it every 3 months, every 6 months. You don't have to do it every 3 months, but usually it can last anywhere from 3 to 6 months. There are clients that only come once a year because it lasts them a whole year, which is amazing. There is also research and data that if you take zinc, 50 milligrams every single day, it helps to elongate the results of the Botox. So, and there's research, there's data about that, so take your zinc 50 milligrams. If you want to learn more about how this amazing procedure works, the benefits, or if you're a candidate for this procedure, go ahead and send me a DM or leave me the question below and I will go ahead and answer that. But if you want a one-on-one consultation with me, go ahead and call the office and let's get you scheduled.